If you are on metformin, you will want to investigate the dark side of this widely prescribed medication. Join us as we dive deep into the crucial information every metformin user should know, unveiling the potential risks that might be hidden beneath the surface. Before we get into today's content, please give this video a thumbs up, drop a comment below with your thoughts, and hit subscribe for more. Imagine someone finding out they have something called type 2 diabetes. It might be surprising because they never thought it would happen to them. Maybe they're a bit overweight, like 10 to 50 pounds more than they should be. They know losing weight could help with this thing called insulin resistance, a big topic discussed in various channels. Enjoying not so healthy foods and treats from time to time, this person doesn't fit the image of someone with type 2 diabetes in their mind. It's confusing and a bit scary. So, they go to the doctor for help because doctors know about medical stuff, right? The doctor runs some tests, like checking blood sugar levels, and uses their training and knowledge to figure out if this person fits into the type 2 diabetes category. They might look at numbers like A1C, which should be less than 6.5%, or fasting blood glucose, which should be less than 126 milligrams per deciliter. The doctor might diagnose this person with type 2 diabetes and then check for other health issues like high blood pressure, high cholesterol, or signs of problems with the liver or kidneys. After looking at the big picture, they might suggest a medicine called metformin to help control blood sugar. It comes with different names like glucophage or Fortamet. But here's the tricky part. They might not give many ideas on how to fix the real issue causing type 2 diabetes, which is insulin resistance. So, this person might just start taking metformin because they're scared things could get worse if they don't. Regrettably, after a few days or weeks, the not so great effects of taking metformin start to show up. There might be stomach problems like bloating, abdominal pain, cramps, nausea, or diarrhea. Also, there might not be much of an appetite. There's a chance of lacking vitamin B12 or developing something called lactic acidosis, which is not common but can be tricky to diagnose. Metformin is often linked with other health issues like infections, cancer, liver failure, kidney problems, and especially heart failure in people with type 2 diabetes. The important thing is, even if there's a feeling of getting worse with metformin, the medication might be continued because it's believed to be the right way to go. Or, if stomach issues get worse, another medicine might be given to deal with those side effects. And guess what? This might be the beginning because there could be more medications on the horizon. By the way, in 2020, there was a recall of metformin because some brands had a substance called NDMA at levels higher than the FDA allows. NDMA is a substance that could possibly cause cancer. Kindly show your support by clicking the like button, subscribing, and feel free to share your thoughts in the comment section. Now, after 3 to 6 months, a return to the doctor happens. The blood sugar levels are checked again, and there might be satisfaction in following the doctor's instructions, but the results show only a small improvement. Type 2 diabetes is still present, even though the medicine has been taken just as the doctor prescribed. The doctor might decide to increase the metformin dose or even add more medications because, well, it's believed to have a stronger effect. But soon, the side effects get worse, and there's a sense of helplessness. The realization comes that metformin is like a fancy band aid. It's not really fixing the problem. It's just preventing the blood sugar from getting higher quickly. Many people end up on this medication train to nowhere, taking more and more medicines that can sometimes cause more harm than good. So, how does one break free from this cycle? Coming up, we'll discover the secrets behind a powerful method that goes beyond pills, reshaping the way you approach diabetes. The frustrating part is that you can reverse type 2 diabetes and live a full life with type 2 diabetes. So, why aren't doctors giving you that answer? Let's break it down. Most doctors aren't required to study nutrition, so they might lack in depth knowledge about the true causes of metabolic conditions. Insulin resistance, a central factor in chronic diseases, influences various health issues. Insulin resistance is linked to different types of diabetes, cardiovascular conditions, cancer risks, obesity, fatty liver disease, and Alzheimer's disease. Women with PCOS, often prescribed metformin, can become insulin resistant. In the top left quadrant, insulin resistance increases the risk of consequences like neuropathy, blindness, kidney failure, and more. Contrary to what doctors claim, these aren't inevitable consequences of diabetes, but result from a nutrient poor diet and lifestyle choices. The influence of the healthcare and pharma industry plays a role. Lobbying and recommendations often lead doctors to prescribe quick pills. Many people prefer easy solutions packaged into a pill, avoiding the effort needed for lifestyle changes. The flowchart shows the common approach, starting with metformin and lifestyle, but the focus then shifts to drugs. This is how doctors are taught to think, often overlooking the potential for real change through specific dietary and lifestyle adjustments. Crucial aspects such as real food, physical activity, intermittent fasting, mindset shifts, and lifestyle changes serve as a potent remedy with minimal adverse effects. Despite the necessary effort, this transformative journey offers substantial benefits compared to quick fix pill solutions. Trusting oneself, adopting a low fat, plant based whole food diet, doing 30 minutes of daily exercise, and practicing intermittent fasting can significantly reduce reliance on medications backed by over 800 scientific studies. In a 2002 study, non diabetic individuals with high fasting blood glucose undergoing lifestyle changes showed greater reductions in blood glucose and A1C, resulting in a 58% decreased risk of developing type 2 diabetes, surpassing metformin's 31% reduction after 2.8 years. The evidence underscores the effectiveness of prioritizing lifestyle changes over excessive medication. The key to managing diabetes isn't just in medication, it's in embracing lifestyle changes. Real food, regular exercise, and intermittent fasting form a powerful combination that not only improves health, but can also reduce the need for medication. Trusting in oneself and making a shift in thinking towards these changes is essential. Remember, it's not about a quick pill solution, but about adopting a sustainable, healthier way of living. If you found this information valuable, please show your support by giving us a thumbs up, sharing your thoughts or questions in the comments below, and subscribing to our channel for more insightful content. Until next time, we wish you the best in your diabetes recovery.